Our project is titled Domestic Violence Survivors Determining Risk of TBI. We're studying female domestic violence survivors to understand their risk of traumatic brain injury. I'm Amithyse. I'm a first-year speech pathology graduate student. I'm interested in neurological deficits, experience in communication sciences and disorders. I aspire to become an aphasiologist, and I hope that this work and similar studies can help me improve as a clinician.
I'm Bethany Daniels. I'm also a first-year speech pathology graduate student. I'm interested in swallowing disorders and neurological deficits. I want to work in a hospital or a VA setting, and this area of study will greatly increase my knowledge in this area.
What is interpartner violence? The CDC proclaims intimate partner violence, IPV, as a serious preventable public health problem that affects millions of Americans. The term describes physical, sexual, or psychological harm by a current or former partner or spouse. This type of violence can occur among heterosexual or same-sex couples and does not require sexual intimacy. Traumatic brain injury is described by the Brain Injury Association of America as an alteration in brain function or other evidence of brain pathology caused by an external force. There are two stages of a TBI, a primary event and a secondary event, the primary being the initial trauma and the secondary referring to the changes that occur gradually.
Why are we studying this? First of all, there's currently a lack of research, and second of all, it's a big deal. Many are injured with the damage being detrimental, and they need our help.
Are women really experiencing domestic violence? For over 2 decades, domestic violence has been the greatest cause for non-fatal injuries to women in the U.S., regardless of personal, economic, educational, and behavioral characteristics. Women are more frequently choked, kicked, pushed, slapped, and physically threatened by their intimate partners than hurt by any other acquaintance or circumstance. The physical abuse is traumatic enough to cause neurological damage. Kiriakou and others decided to investigate the effects of such abuse in individuals, as well as what similarities in social, economic, and behavioral characteristics these women might share in their article titled Risk Factors for Injury to Women from Domestic Violence. In a span of 15 months, data was obtained from 8 geographically diverse emergency room departments, studying 256 women who were intentionally injured within 2 weeks and 659 control group women who had not experienced any intentional injuries. The studied population and the control population consisted of women between the ages of 18 and 64. At every study site, research assistants identified, interviewed, and selected any eligible woman participant. Research assistants administered a verbal standardized questionnaire to women throughout emergency departments to identify those with a history of trauma or signs of injury. Of the 256 women that were intentionally injured, over 35% experienced head and face contusions, and over 10% experienced loss of consciousness, depressed skull fractures, ruptured ocular globes, and facial nerve lacerations. The research also found that minority women with more than a high school degree, making less than $30,000, and who had abused alcohol were more likely to experience domestic violence attacks from a minority male who was a high school graduate with intermittent employment and experiencing alcohol or drug abuse. The findings of the Kiriakou study were gathered from 8 varied geographic locations, allotting to a diverse population pool. Likewise, the authors purposefully decided to non-randomly select their studied participants and to vary the control group by including women from various emergency departments within the hospital and sites, allowing these findings to be more generalized to a larger population. Lastly, since the women were studied within 2 weeks of their injury, these studies can be continued for a longitudinal study. On the contrary, the data was collected through interviewing and questionnaires, and self-reporting can prove to have recall bias and inconsistent responses. Similarly, women were questioned regarding their partner's drinking and drug abuse, but not their own, which could lead to skewed and biased data. Are women acquiring brain injuries? If so, what's the severity, cognitive, and psychological deficits? In another pivotal study, Valera and Brennan-Baum studied whether women living in shelters and non-sheltered women were sustaining brain injuries from their partners and whether those injuries are associated with partner abuse severity, cognitive functioning, or psychopathology. The study included women from battered women's shelters in various intervention and prevention programs. There were 99 women involved, and all 99 women were between the ages of 18 and 54. They represented a diverse ethnic cohort. All had graduated from high school, and over 50% were employed during the study. Over the course of 2 sessions, researchers conducted 4 assessments. 1. Self-reported partner abuse severity. 2. Brain injury interviewing. 3. Cognitive functioning testing. And 4. Psychopathology questionnaires. Researchers found 68% experienced mild traumatic brain injury and 44% experienced multiple brain injuries. The study also found correlations between women with higher brain injury scores having lower cognitive functioning and low verbal naming and recognition scores correlating to their higher partner abuse. They also found women in shelters sustained higher rates of being choked and severe brain injuries, while women not in those shelters experienced higher rates of one or multiple mild traumatic brain injuries. The article contains several strengths, the first being it assessed a large and diverse population pool. Secondly, to combat the occurrence of biasing, the researchers administered more subjective measures, being the partner abuse severity, before administering less subjective measures such as the neuropsychological testing. Although initially not taking brain scans and images were considered a weakness, the authors discussed that in terms of multiple and mild traumatic brain injuries, brain scans do not always reveal abnormalities or the complete image. On the contrary, participants were administered all their assessments by the same assessor in each session. Therefore, an emotional connection or bias could have formed between both parties. The authors also did not explicitly define physical abuse beyond what the assessments were measuring.
The other question that we would like to focus on is self-reporting appropriate through the use of online surveys? One thing that is obvious is that there is little research that studies both the population of domestic violence survivors and the use of online surveys for self-reporting. This research that I'm getting ready to introduce may not appear to have the same focus as ours. However, the participants have experienced a traumatic event, and the researchers, Hart and Lancaster, are measuring function as a result of these events. So it is not too different than what we are studying. Researchers Hart and Lancaster conducted a cross-sectional experimental study, and they titled it The Initial Validation of Self-Reported Trajectories in Military Veterans. They used an online survey to collect self-reported data on the physiological functioning of 89 military post-deployment veterans, so basically focusing on PTSD symptoms. An online survey was used to obtain the self-reporting, which was compared to the performance on standardized measurements. The mean time since their last deployments was about 13 years. Hart and Lancaster focused on 4 classifications which they called trajectories. These were chronic dysfunction, delayed reaction, recovery, and resilience. They also proposed very complex hypotheses for each trajectory. Some of the strengths noted in their study were other measurements used were validated. Aside from the online survey, 5 measurements were given to each participant, and these were to compare reportings within a range. All of the tests were validated, and some even received strong empirical support. Also, they provided multiple response options, such as "okay then," "okay now," or "okay then, struggle now," rather than just a yes or no answer option. This increased response accuracy because it was more representative to the true feelings and experiences of the veterans. Rather than making things, if you will, black and white, this provided the researchers with a measurement that obtained a true range of present functioning versus functioning following their deployment. They also considered the individual differences when designing the survey. Again, providing various response options was helpful. The researchers, Hart and Lancaster, were sensitive to the fact that the veterans had experienced traumatic events and could potentially still be in a vulnerable state. This was factored in when designing the study and when analyzing the results. When recognizing some of the weaknesses of their article, the sample size was small and was lacking diversity. There were only 89 military veterans included. Considering the amount of social media servers that were used to release the online survey, this seems like a small sample size. However, the true number of veterans with PTSD is difficult to pinpoint since they must seek help or choose to self-report. 80% of the participants were male, which estimates a pretty true reflection of the gender ratio in the military. However, 79% of the sample size or population were Caucasian, which is not truly representative of this population. This may present bias in the ability to generalize these findings. Also, all data were collected cross-sectionally. Although they recognized that other research methods are difficult to carry out on this population, they noted that this is a great limitation to their ability to measure the accuracy of the experiment. They suggested that longitudinal research is needed. Protecting participants' privacy and confidentiality was not necessarily addressed. They did not say if or how they presented how the participants' information would be kept confidential. For example, they included no consent form, and this was not mentioned, and this seems to hurt the credibility of the researchers. The researchers found that the participants were able to successfully place themselves into trajectories with the use of the online questionnaire. Furthermore, this provides greater methodological flexibility because it potentially eliminates the need for an accompanying interview or other assessments. Our main focus will continue to focus on the following question: how reliable and accurate is self-reported information from surveys for those at risk of TBI associated with intimate partner violence? So depending on the variables used with an online survey, several limitations can exist. Some examples of this are being unaware of the completion or response rates from the participants, being unsure of existing factors in the participant's environment, and the concerns that exist with reliability for eligibility requirements. We will continue to examine whether self-reporting is appropriate in regards to this population and sensitive topic. We will consider potential alternatives to gathering information. In conclusion, we'd like to point out some important things. Domestic violence is a silent epidemic. For the individuals who do not have a voice or the knowledge, we can help. Professors at UNCG have an ongoing study exploring the risks for traumatic brain injury among victims and survivors of intimate partner violence. We will be assisting this research. Once all data is collected, we will further explore statistics and characteristics of women with IPV to increase awareness and expand information available for research, prevention, assessment, and treatment that is necessary and doable. These are our references that were used for the articles and for definitions. Also, check out seethetriumph.com to see more information about the current study and obtain available resources on and for women experiencing domestic violence.